Hello, I'm Amie Taylor and I wrote the Monster Book of Feelings, and for this Children's Mental Health Week I thought I would give you just a few tips on talking about feelings and emotions with children, be it your own children or ones you work with or children that you happen to know and have in your life. So tip number one, use stories. Using stories can be a really good way to open up conversations around feelings and emotions, whether it be books that are out there specifically talking about feelings and emotions, but really any book that you're reading with children. You can ask questions like, how is this character feeling at this point? Or, oh, they were really angry. What would you do if you were them? Or what advice might you give them if they're feeling really sad at this point of the story? And it can be a really great way to just open up some further questions and conversations around feelings and emotions. Number two, try not to minimize feelings. Some of the things children tell us they worry about can seem really small or insignificant to us as adults, or we know that they're not something that the child needs to worry about. And I certainly remember as a child having lots of different worries about things. And sometimes at school I would share those with the teacher and be told, oh, not to be silly, or oh, that won't happen, or, and it was kind of just shut down. And I think actually giving all worries and feelings a little bit of airtime and conversation can be really helpful both for you and the child. Number three, try not to label emotions or feelings as positive or negative. There can be sometimes a bit of a temptation to group them, but actually all feelings are really useful and valid and should be welcome. I think. And of course, there can be positive and negative responses to certain feelings and emotions. And I think a really useful thing you can do is talk through with the child, not in the moment that they're feeling that emotion, but kind of, at a time when they're calmer and not feeling that emotion, what their response might be and what they could do and how they could respond, and maybe what a useful way of responding might be and a less useful way of responding might be to that specific feeling or emotion. And finally, breathing. So breathing is really, I think, important. And I'm a drama practitioner, and I have spent 15 years teaching breathing to children and young people as one of the parts of my job. And it's very normal when a child is upset or angry, we kind of tell them to take a few deep breaths. And I know through teaching breathing as well that quite often when you ask a child to take a deep breath, they kind of do this, where they go, and they suck their stomach in and their shoulders go up, and actually what they've done is they've just squashed all their lungs, and they're not taking a deep breath at all. It's actually they've kind of reduced their lung capacity massively. So I think teaching children to breathe is really important, and not doing it in the moment where they're really angry or upset, but kind of setting it up as a practice that they have for life. So just if you're doing that, I often get children to put their hands on their tummy, because if you're breathing properly, there should actually be very little movement at all, just expansion lower down. So kind of getting them to put their hands on their tummy and just to feel their tummy going in and out. And you can count with them to help them as well, to take their breaths. But the hope is that if this is a practice they have day to day, that in those moments where they are upset or angry and they need to draw on it, it's kind of instinct or second nature for them to do that kind of proper deep breathing, which can help calm yourself. I hope these tips have been useful for you this Children's Mental Health Week. Thank you so much. Bye.